Hello friends, I am Dr. Mayank Madan and I am heading the Department of GI and Bariatric Surgery at CK Birla Hospital. As we all know, this is Corona season and we have been seeing a lot of obese patients, lot of my overweight patients. They are particularly concerned vis-a-vis this Corona pandemic. So I thought I should come up and clarify a couple of points which are very important for all the people who are overweight or who fall in the category of obesity. Here I want to reiterate that it's very unfortunate that Corona loves the flab. Corona loves obesity. All the obese people or overweight people, they are especially at risk. So I wanted to highlight a couple of facts here. One of the major risk factors for developing COVID-19 infection, and that too especially for younger population, is obesity. People who are in category 1, 2 or 3 obesity, they are especially at risk. Anyone having a BMI more than 30, they are at risk. And independently, I would say, not saying that because of diabetes or hypertension, even without any of these factors, obesity per se is a major risk factor for developing COVID-19. Another thing to remind you is that it is a major factor for determining the admission into ICU. There are a couple of studies from US and Europe which are showing that people who are obese, that is more than 30 BMI, they have around twice as chances of getting into an ICU if they develop a COVID-19 infection. Similar is the relative risk for having an adverse result, that is in form of death. There are up to 3 times chances of people who are overweight and obese to have a lethal outcome if they develop a COVID-19 infection. One more factor, as you all know, that obese and overweight people, they do usually have comorbidities like diabetes, hypertension, heart disease, and especially some lung issues. They might be having sleep apnea. So all these comorbidities, they independently increase the morbidity if these people develop COVID-19 infection. Another very important factor is that obesity per se, it's a pro-inflammatory condition. That means it induces inflammation. Even without any other infection, it is a pro-inflammatory condition and your body immunity response has to be there. The body is already in a fight mode when you are obese. So if you have another infection on top of it, like Corona or COVID-19, then definitely the body's immune system may get bogged down earlier. So it's not a very desirable condition when you have obesity at hand. Another scientific point, maybe a couple of you might understand that COVID-19 or the coronavirus that enters the cells through ACE2 receptors, and these receptors, they are specially expressed highly in the people who are obese. They are highly expressed in fat cells. So again, if you are exposed to COVID-19, there are more chances that the COVID-19 virus might get access to your cells because the lining through the fat cells itself. So what should be the precautions that all of us should be taking? As I told you, that first and foremost thing is to acknowledge that obesity is a risk factor. You should acknowledge that you are overweight and you should be taking extra effort, extra precautions to prevent or developing this condition. All the social distancing measures, using masks, using gloves, unnecessary going out, all those should be done, and more so by all the overweight and obese people. The second thing is, take all your regular medicines that you have been taking probably for diabetes or your heart disease or your hypertension, because any of this may go haywire, and if you are not taking regular medication, you are particularly at risk. So be in touch with your physician, whosoever is looking or taking care of these conditions for you. Another point to emphasize here is that Corona particularly affects the lungs. So all all these measures like pranayam, yoga, incentive spirometry that will increase your lung capacity and may be helpful in preventing the complications, God forbid, if you develop a COVID-19 infection. Another important point is that during this period of lockdown, there is a tendency to go in for processed food, to go in for canned foods. So avoid doing that. They are actually, they will be very harmful for you. Canned foods, they are very high in sodium, so might be very harmful for your heart disease, for your hypertension. Another thing is for people who are overweight, they usually think that probably we should go in for a crash diet, that we are sitting at home, then we should be looking at losing weight, so people tend to go for a crash diet. That's a strict no-no. I'll suggest that may be even counterproductive, because this is a time when you should be having good immunity. So no need to go for crash diet. Instead, I would suggest that you should indulge more and more in exercise so that you can keep your body mass, basal metabolic rate high, and that can help you in maintaining the weight during this period, as well as at the same time maintaining your immunity as well. So my friends, stay safe, stay healthy, and maintain all the social distancing norms. And this is especially for all my obese and overweight friends. Take care.